I'm Michael David, and you're watching Eye on Sun Valley's Roundtable. Issues in Focus.
Farmers Insurance, the Christensen Agency, Ketchum and Haley, protecting your future one asset at a time. 208-726-6046.
Suicide, an issue that affects almost all of us, yet we rarely talk about it. I've been told that people don't necessarily want to end their lives. They want their lives to change. And the tragedy is that they reach a permanent solution for what should be a temporary problem. In our community and in communities across the nation like ours, we are losing our children, our parents, our spouses to this epidemic far too often. Veterans die by suicide at alarming rates. In my tenure as executive director of the Drug Coalition right here in Blaine County, I talked to many young people who felt so hopeless and disillusioned that they had contemplated suicide. How did they get to this point? Is it a result of childhood trauma, abuse, bullying, isolation, depression, or a combination of the above? Joining me to discuss this critical issue is Dr. Susanne Choby, psychiatrist, St. Luke's Medical Center, Reverend Jill Iris, Light on the Mountains Church, Mayor Chris Koch, Blaine County educator and NAMI board member, and Alex Feldman, a recent graduate of the community school right here in Sun Valley. Dr. Choby, let me start with you. As a medical doctor, can you help us lay people understand why people get to this point?
Well, I think it's a complex issue when it comes to suicide, attempted suicide, the interface with mental health and substance abuse. The most important thing that we need to do in the community is not be scared or uncomfortable to talk about the issue. A lot of times what we will see in the mental health clinic when people come in to get help for mental health needs is a bit of surprise when they bring up suicidal ideation or thoughts of suicide.
Right.
The fact that no one in the clinic freaks out about it. And I think it's really important to be able to have a frank discussion about the issue without panicking.
Right.
Generally, when people get to that point, they're pretty raw emotionally, and they don't see that they have many options. And I always like to reframe suicide away from an illness model and more towards a model of a situation where someone feels as if they do not have any viable options, with the exception of ending their life.
Right.
In the majority of cases I've seen, if someone has an option aside from suicide, they will generally take that route. People tend to have a lot of self-preservation.
Yet they feel oftentimes that they don't have the
Absolutely.
alternatives. Correct.
So I think the most important thing we can do is be aware of the warning signs and be there to intervene and support people during that crisis period until it passes. Because as you said, it is a permanent solution to a temporary problem.
Right, right. Alex, as a young person growing up in the age of social media, cell phones, 24-hour news cycles, can you maybe shed some light to those of us that grew up in a little different time period, the pressures that young people feel and what may drive them to such hopelessness?
Sure, definitely. I mean, I think it can be anything as small as receiving some hatred online from someone, a Facebook post, a Facebook message, whatever it may be, or, people not liking photos, or, that because people they base their self-worth on their likes that they get and their comments and things like that.
Right.
And that's not what it's about at all, So I think part of it is a misshapen view that's been provided by society and us. So I don't know what about it needs necessarily to change, but
Right.
That's what I see.
Yeah, I mean, Chris, as an educator, does some of this ring true? Do young people, what do they tell you about what they're facing?
It's a little bit about what they both said. There is the likes and the messaging and the Facebook and the instant social media stuff. I think we're creating a society right now because of cell phones and computers and Facebook and all these different things, of a society that can't cope with face-to-face conversations. They see something, they see an instant message, and they don't understand that it all can be cleared up with just a, hey, how's it going, or a simple conversation. And they're relying on whether they got 10 or 15 or 100 likes on a silly photo of them. And they're like, that's my self-worth. We're creating a group of socially awkward teenagers because of social media.
And I think another part of that is that when you do receive said message online or send said message online, you don't have the tone of voice or,
Right.
me moving my hands or
There's
someone.
no context.
There's no
There's no
inflection.
context. Yeah,
Right.
you can't see their face. You can't tell if they're joking or not.
Right.
Tone of voice plays a big part in
A
that.
huge part, and a couple simple words of whatever they happen to be, the tone of voice can completely change everything
100%.
about three words. And we all look at it. We can all joke around. Mike, you and I have known each other for a long time, and I can call you up and you can say something to me off the cuff, and I know you're joking because of how your tone of voice is,
Right.
or how your eyes are moving in your face. Where if you send me the same message, whether it be text, Facebook, or whatever, I'm gonna be like, oh my God, what does this mean?
Right.
And so that we're creating this generation that doesn't know how to deal with this.
Right, and it's also just not one-on-one. When it's out there for the world to see, quite literally.
And each person takes their own interpretation from it. You know?
Right. Reverend Iris, people come to you in your profession, and I'm sure you see people that are in pain. What kind of things drive people to such levels of despair?
I think that not discounting, but setting aside mental illness that would exacerbate anything that happens to them, that would be amplified.
There's a feeling of disconnect, and I think they're either disconnected from their family, disconnected from their community, and disconnected from themselves, from their spirit, and that's what I see most. And so it's creating an environment where they feel connected at least to one person, and then you can begin from there.
Right. But that isolation is...
They feel isolated, and I think our social media, as you were saying, Alex, is a huge contributor to this feeling of isolation.
Right, not just for young people.
No, for all of us.
Right.
Yeah.
Yes. You kind of alluded to it, but I want to talk about bullying. It seems like, is it as real an issue as we talk about it?
Yeah, I think it is. I think it's a little different in our community just because we have such a smaller population. It's harder to really kind of discern what's really going on.
Right.
But I can tell I can speak on my own experiences and the fact that I was bullied in middle school, and it definitely impacted me. And I wasn't necessarily drawn to that edge, but I definitely felt alone and isolated because of it, and I ended up finding music and finding my way back into people and reconnecting with them through that. So I think there's always a way out for everybody. You just have to find what really speaks to you.
Right. No, and I know in the schools we've had issues with bullying and hazing, and I think it's a real thing, isn't it?
It's been going, and it's nothing that's new. Bullying and hazing and stuff is not a new issue. I think there's new, easier outlets for the bully to be able to approach the person they're bullying. And there's a lot more. It's a lot easier for them to do these acts of bullying.
Right.
They can do. When I was a young person, and everybody but Alex here, before social media, before computers, and all this kind of stuff, it was little pieces of paper, and it was completely different. Now, it's a secret message, whether it be Snapchat or Instagram or Facebook or whatever.
Right.
And some of it, and there was years ago, there was another social media outlet called Yik Yak, which was a little bit more anonymous.
Right.
And so there's ways to do these things without anybody actually knowing. And so going back to what Jill says is that isolationism starts because you don't know who your accuser is. You don't know who your attacker is.
Right.
And so you start looking at was it Jill? Was it Alex? who was it? You're like looking at your close-knit friends and like, how do they know?
So it becomes a much bigger deal than maybe it might have
back
been.
in the day when it was a little piece of paper or something written on a bathroom wall or something like that.
Sure. Doctor, we all experience sadness at times, and that's probably normal and a good thing too. But how does it rise from a level of a sadness to depression or something that can really affect someone?
Well, the most important feature that I always look for when I'm evaluating a patient is the presence of what I would classify as functional impairment. So there are plenty of people that come in that have normal human emotions, and in essence, suffering is part of the human condition to a certain degree. Where it rises to what I would call a diagnostic category of illness is when it's so pervasive and so disruptive that it is impairing a person's ability to interact with their family, parent their children, perform their occupation, just basically get through their day-to-day life in an average, normal fashion. And the biggest thing that I look for with depressed patients as far as assessing suicidal ideation is the presence of something called a sense of worthlessness or hopelessness. And individuals who feel as if they have a purpose, whether it be a professional calling, spiritual calling, an athletic calling, something that they're really passionate about, a musical calling, exactly. That purpose in life, that sense of purpose in life, actually has a very potent protective effect. But when someone who has, let's say, a musical calling starts not wanting to play music, or just says, it's not worth it, I don't care anymore, and you notice a significant shift. Those types of things, those subtle functional changes are what tend to get our attention as mental health professionals.
Yeah. Well, and we'll get more, I think, into the signs and signals that we can look for. We are in what they refer to as the suicide belt. In the Rocky Mountains, the incidences of suicide attempts, ideations, and suicides is way above the national average, and Idaho is consistently at the top of those lists. What is it about the Rocky Mountain region? They talk about ski resorts also. Any insight into why it's like that here?
Actually, yes. There's a high level of competition. There's isolation. Our community in particular, and we've talked about this in our task force meetings, is that there is not as much of a sense of community. It's very transient. Either the people have second homes or they travel quite a bit. And I've also heard, and Dr. Choby can perhaps comment, that the altitude and the lower level of oxygen actually can exacerbate some of the tendencies that you might have for some brain chemistry disorders.
Right.
But I think it's the competition and the isolation.
Right, and we're in such an ideal place in so many ways.
It's paradise.
Right. Yeah, no, it's fascinating that things seem so great here, and that you can see this. So, this has been an awesome discussion about some of the reasons leading to suicide. After a short break and a word from our sponsors, I want to come back and discuss the stigma attached to suicide and to mental health issues, and maybe some of the signs and that we can see and notice, resources that are available, and what we as a community can do to help each other. You're watching Roundtable Issues in Focus. We'll be right back.
Eye on Sun Valley's Roundtable is sponsored by the law firm of Stephen D. Thompson, Attorney at Law. Personal practical representation. 120 East Avenue, Ketchum. Call us 208-726-4518. And Accord Capital Management, your conscious portfolio. Mark W. George, 877-726-5594. M. George at AccordCapitalManagement.com.
Atkinson's Markets, better food, better price, better service.
Welcome back. We all know about the stigma surrounding suicide and mental health issues, and we've experienced or know about the resistance to treatment and other barriers to access resources. what can we do to lessen or end that stigma and to increase access to resources that can make a difference? Doctor, do you have thoughts?
Well, as far as prevention goes, if I may touch on that,
Yes.
A couple of things come to mind that I think are very important to mention, especially since the average person out there doesn't have a psychiatrist living next door or a therapist living next door. So the number one question that I get is, what can we do if we have a family member that is expressing suicidal thoughts? The first thing and the most important thing is to make sure that that individual does not have access to lethal means. And by lethal means, I mean specifically firearms.
Right.
The guns have to be taken out of the home. Completed suicides, the highest number of completed suicides in this country are by firearm.
Right.
Then hanging, then overdose. So restricting the access to lethal means is the most important thing that people can do.
Sure.
That also applies to certain classes of individuals. Certain subsets of our population have a higher tendency to attempt and complete suicide, and those include people with substance abuse issues. Almost 30% of people who complete suicide have been intoxicated at the time.
Right.
People who have mental illness such as depression, bipolar disorder, schizophrenia, people who have suffered traumatic brain injuries, which can also lead to depression and a greater level of impulsivity. So as far as that goes, the most important thing that family members can do is prevent the person from gaining access to means to actually complete a suicide, and reach out and get them to a safe place, either the emergency department or another medical facility where they can get help.
Right. Now will people ask for that help, or is it the people that don't talk about it that we're most worried about? What are some of those signs?
Well, both.
Right.
Some ask, some don't.
Sure.
But I think what I have found in my pastoral counseling is that they come in for something else, and by listening, of course, deeply listening, you hear that where that disconnect is. And the fact that they've come in, though, is always helpful and hopeful for me, because it means there's a spark of hope, and so you build on that to create a lifeline, whether it's to refer to a medical facility, prayer work, other types of action and support, and a lot of things not to do with family members too, which is, oh, you're fine.
Right.
Which is really dangerous. We call it the spiritual bypass. It's all good, and you really want to hear the person and then listen for what's going on within them. And it's rarely do they come in for an appointment with a minister and say, I want to kill myself. It's usually, my husband's driving me crazy. And then they go into what's really at issue.
Sure. Alex, from a young person's perspective, do you feel like the resources out there are within your reach, or that there's obstacles to getting help?
Yes and no. There are a lot of resources out there. I think the obstacle is the peers surrounding these individuals. They, someone may be expressing these feelings, and the people that surrounding them are either like, oh, that's not cool, what?
Right.
So I think it has a lot to do with friends, honestly, in situations, because peer pressure is a huge thing, and not necessarily that they're pressuring each other into doing said act, but it's just,
you're going to be all right.
It's
all right.
Yeah.
Right.
And if I may,
Sure.
something that we could all get more comfortable with is actually talking about suicide.
Right.
No one has ever said, are you thinking about killing yourself? And the person says, no, that's a great idea. I mean, you're not going to give them that idea by bringing it up.
And yet there is there's been that hesitation for years.
Absolutely that stigma, and people freak out when someone says suicide.
Right.
And oftentimes, if you just ask, the person wants to be given the opportunity to say, please help me.
Right.
And what people who aren't medical professionals can do is they can put down their phone, get off the computer, and they can go and they can say, hey man, are you okay? Is everything going okay?
Yeah.
And that basic human connection, that that social reciprocity, that message that there are people that care about you is sometimes enough to open the door to a discussion.
Right, right.
And that's something that we can all do.
Sure, sure. And you know, the incidences amongst males are so much higher than females. And Chris, as men, it's almost as if we're conditioned, right, to not talk about our frailties or our vulnerabilities and keep it inside. Is that something that resonates? And how can we learn to talk about it?
Well, it definitely resonates among men because we're always supposed to be kind of the stronger of the two, and so we're kind of conditioned like just shake it off, don't talk about it. You're fine,
Right.
rub some dirt on it or whatever. You're going, talking about just even sports injuries and stuff like that, but be able to open up the conversation with somebody that you can trust and you feel like you can call up, or just like you mentioned, like, hey man, are you okay? To be able to walk up to somebody that you can have a conversation with, it's like, hey, I'm kind of having a bad day.
Right.
And being able just to say that, and that might just open up that door of conversation and that level of trust, and breaking down that little bit of stigma that might be around the issue or the concern, might open up an entire dialogue that just might make you feel a little bit better about your condition. And the person you may be talking to is like, hey, I've kind of been through the same thing. Let's go have a cup of coffee. Let's sit down and talk about it. Let's go let's go skiing. Let's go for a hike. Let's get some, natural endorphins going, and let's talk about what's really going on.
Right.
And talk about the issues and break down some of the stigma that's around these issues.
Right.
And being able to talk about it. I'm hoping that, after this roundtable discussion, the 4 or 5 of us, or, the people that are in the audience, if one of us sees each other in, a coffee shop or wherever, like, hey, how's your day going? And sometimes that's all it takes to make somebody feel a little bit better, that somebody's just asking about them, and that they're just having, like, somebody's actually asking about me.
Right.
Hey, and it could be a 30-second or 5-second interaction between each other, but that pleasant interaction between two people, I think, helps so much in the long run.
Sure. Yeah. Well, and I think about trying to get rid of some of those old myths. You used to hear about, suicide is a selfish act, and from a spiritual, religious perspective, it's even referred to as a mortal sin. How can we, from a religious perspective, try to break through also on the stigma?
And I think it's one-on-one, and from the teachings, our faith tradition absolutely does not believe it's a mortal sin. In fact, what I would encourage and love someone up is with, there's nothing you can do that God doesn't forgive. Right. There's no reason to condemn. You're not condemned at all. You're loved.
Sure.
Beyond measure.
Yeah.
And to reassure that person. We don't want someone killing themselves, but it's not a mortal sin.
Right. No, and Alex, I think that I feel hopeful too that your generation is feeling less like you need to bottle things up, and don't you feel that?
I agree. I think it differs person to person, though, just to be completely honest with you. One person that has an issue may be more open to speaking about it than another who does,
Sure.
So I think it's more just person to person, really.
Right. There are some great resources in our community. Can we talk about what we're doing as a community to help each other? Sure.
Well, I think that the work NAMI is doing right now to reduce stigma and to make it more of a tabletop conversation.
Right.
And I think the program that we're launching, a public awareness program on Know the Signs, and similar to what the Advocates is doing with reaching out and intervening.
Right.
In other words, going up to someone and saying, "Are you okay?"
Sure.
And we're hoping that this public awareness program will actually reduce a lot of the barriers and obstacles to getting help.
Great.
Well, and even within NAMI, there's now a high school program, and there's some youth advocacy within the high school trying to break down that stigma of high schools, and so they know within the school who to talk to and where to go for these different issues.
Right.
And I'm not sure at the community school when you were there and stuff like that, if that was there, but even in the last few years, I feel that the counselors at the school are more aware of the things that are going on and more open, and even the teachers and stuff in the school are more reaching out to the young people, like, hey, are you having a good day? Or, hey, I see you're kind of stressed. Do you want to maybe
that awareness level and willingness to talk is getting better. And Doctor, we're so lucky to have you in our community, the clinic and everything as a resource too. Tell us a little bit about that.
Well, first and foremost, I have to mention that I have a fantastic team over at the Mental Health Center. I have fantastic therapists, a crisis nurse that also helps me out every single day, and of course a wonderful clinic manager and supervisor. So I'm very, very fortunate to have had the opportunity to join that team.
Right.
We take care of the full spectrum of mental illness as far as older adolescents and adults.
Right.
We have a lot of fantastic support from St. Luke's and from the community, so I'm very thankful. I believe that there will be some information at the end of the program about how to contact us for an appointment.
There will be,
Okay,
yes.
great.
Great. And I really want to thank all of you. And Alex, in closing, do you have any advice for young people in our community?
Yeah, I would say to everybody out there that's struggling, just believe in yourself and remember that power to change your life is within all of us, and it's within you as well. So never give up.
Yeah, that's great stuff. This is a heartbreaking issue, but at the same time, it's a hopeful issue. And I think that if we pay attention to ourselves and to those close to us, and remember that people don't want their lives to end, they want their lives to change, and their lives can change. There is hope. There is help out there for those that seek it, and your life will get better. I'm Michael David. I want to thank all the panelists for being here. You've been watching Eye on Sun Valley's Roundtable, Issues in Focus. We'll see you next time.
I'm Erin Pfaeffle. I'm the Director of Community Relations and Mental Health for St. Luke's Wood River Medical Center. You all had the opportunity to listen to a really critical, important conversation about suicide prevention and mental health. I thank the panel for being willing to have the courage to talk about a sensitive issue and bring forward into our community a normalizing conversation about issues around mental health. I'm here to remind you all who are suffering, who may not be feeling well, who may be in distress, or know somebody who may be in distress and need help, that you're not alone, that there is help and there is hope. We have an unbelievable community of people and organizations working together to keep us as well as possible here in Wood River Valley. There are a few national hotlines that are 24 hours a day for those who may be in crisis. National Suicide Prevention Hotline, 1-800-273-TALK, and a crisis text line for those of you who may feel more comfortable reaching out via text, 741-741, and text the word home. Here locally in the Wood River Valley, we have a variety of resources and people who are available and skilled to listen and get you connected, or a family member or loved one connected to the resources they need. St. Luke's Center for Community Health is available to sit with you or a loved one, a friend, and assess what needs you might have and get you connected to the most appropriate resources here locally or regionally, either through St. Luke's or any of our community partners. Please call us at 208-727-8733. We have a local crisis hotline, 208-788-3546, 24 hours a day availability. We have an amazing organization called NAMI, great advocates for reducing stigma and helping us bring into the forefront conversations about mental health. Please call them if you want to reach out for resources, 481-0686. You are not alone. We have a community of amazing people who are here to help and to listen and to support. Please reach out. Thank you.